You mentioned macular degeneration. Talk about what that is and how it forms.
Yeah, so macular degeneration is it's one of the leading causes of permanent vision loss and blindness for people over the age of 50. The challenge with macular degeneration is that it affects the central part of your eyesight. So reading becomes nearly impossible. If you and I were sitting across from the table and I was trying to look directly at your face, I would not see your face or your head. I would still see my peripheral vision. Assuming I didn't have any other eye disease, I would still see my periphery. But your like acuity, your ability to read with your peripheral vision is very, very low. And so macular degeneration can be devastating. You can imagine, I've had patients who are like, oh, we're going to wait till our retirement to go travel around the world. But then they come in and then I have to give them this devastating diagnosis that they have this historically irreversible blinding eye disease. So it has always been one of my deepest fears that crap, I'm going to grow older and I'm going to develop this disease. So we don't understand everything with macular degeneration, but it's where the tissue of the retina degenerates and stops functioning. And the cells with the photoreceptors within the back of the eye, they start to degrade, and we see this buildup of a protein in the back of the eye called drusen, which is more or less cellular garbage, is without any other best way to say it. So the photoreceptors, right, your rods and cones, they are supported by a kind of a scaffolding structure called the retinal pigment epithelium. And this RPE, or retinal pigment epithelium, they supply all of the nutrients to grow the photoreceptors and to fight oxidative stress and inflammation. And every time a photoreceptor gets light energy like photons, it sends this signal to the brain, but then that photoreceptor is used up. So your body has to phagocytize and eat up the garbage, old, used up photoreceptor, and has to generate a new one. And so this drusen is more or less a buildup of all these cell membranes of these dead photoreceptors that the body, when you're young and healthy, is able to basically eat up and get rid of. But in macular degeneration, for some reason, it starts to just accumulate. It's like somebody's throwing the garbage out on the street, but the garbage man's never come to pick it up anymore. So it just builds up and builds up. And so this generally happens to people over the age of 50, and it gets more prominent the older you get, so closer to your late 70s, 80s. There is some genetic factor. So some people have what's called complement factor H. It's part of your body's immune system for fighting inflammation. Just doesn't work correctly. And so we see higher risks of macular degeneration. And there's two types. If somebody was, after hearing this, if they ever talk to their family member or they see an eye doctor and they're told that they have macular degeneration, they'll probably either hear dry macular degeneration or they'll hear wet macular degeneration. Dry macular degeneration is just when the photoreceptors slowly stop working and they kind of decay. Thankfully, dry macular degeneration is most common and it's not as severe. And so it slowly develops over time. Wet macular degeneration is more aggressive. That's where, because there's so much oxidative stress and inflammation inside the eye, the body realizes, hey, I'm not getting enough nutrition or whatever the metabolic whatever's needed for the proper metabolism of the retina is not there. So it releases this signal, this chemical that we call VEGF, vasoendothelial growth factor. And this is basically like a big red flag saying, hey, I need nutrients, send blood vessels here. So your body ends up growing new blood vessels into the eye, which sounds good, but it actually destroys the architecture of the retina, and these new blood vessels will leak. They leak fluid inside the eye, and this fluid can make your vision distorted, extremely blurry, and it happens very quickly. So we call that wet macular degeneration. And right now, the only treatment really have for wet macular degeneration is getting an injection of an anti-cancer medication inside of the eye, which encourages these blood vessels to recede and go away. And unfortunately, that type of medication is also expensive. So not only do people not want to get a shot or a needle in the eye, but they also can cost several hundreds to maybe thousands of dollars for every injection. And people will get these injections every 4 to 6 weeks sometimes.
So the red light device is only for the dry?
So right now it's for dry, which again, for most people, it's more common to get the dry macular degeneration. But I'm just excited because this is like the start, right? We haven't had, outside of this red light device, all we've had to treat macular degeneration is either these injections. Long time ago, they used some forms of laser, but they weren't super effective. And then we have vitamin supplements, because that's, you'll hear some doctors in different fields. Some doctors are very anti-supplement, right? In the field of eye care, we're one field where we have very strong evidence of the benefit of taking certain supplements, specifically for the disease of intermediate dry macular degeneration. And so basically they did these studies. The famous ones are known as the AREDS or AREDS 2 studies. They're age-related eye disease studies. And these are thousands of people that they followed very closely over about 6 to 9 years, depending on the study. And they basically not only saw them for eye exams and followed their eye health, but also they tracked their dietary habits and other lifestyle factors, including supplementation in some branches of the studies, and found that certain lifestyle habits decrease the risk of developing macular degeneration, as well as decreasing more of the progression of the disease. And so they were able to basically make this cocktail of vitamin supplements that could slow down macular degeneration by about 25% over the course of 5 years. So for anybody that's diagnosed with at least an intermediate stage of macular degeneration, of dry macular degeneration, then it's more or less standard of care for the eye doctor to recommend or prescribe these specific eye supplements.
And what are the specific nutrients involved?
Good question. It's changed and evolved a little bit over time because they've done these studies a few times trying to test, hey, can we change the level of zinc, for example? The original formulation had vitamin C, had vitamin A in the form of beta carotene in it. They also had some level of like copper and zinc in there. And the copper was really put in, I should say, they put copper in there because when you take supplements of zinc, and I imagine you may know this, but if you're taking zinc supplements, it can reduce your copper absorption from your diet. So they added copper in the form of cupric oxide into it just to help get that back in there. As it's evolved, as the supplements evolved, and now the current one, they had to remove beta carotene because they later found out that people who supplemented with beta carotene, if they had previously smoked, had like almost a 2-fold increased risk of lung cancer. So they got rid of the beta carotene and they put in lutein and zeaxanthin. And those, we can talk more extensively about those because those have not only antioxidant benefits for the eye, but also a anti-inflammatory benefit that can also improve eyesight in some ways, as well as help improve visual memory and cognitive benefits for both adults as well as young kids. But primarily, that's what's in those supplements. They did also study omega-3s a little bit in those studies, and that gets a little bit more nuanced. But we also know omega-3 fatty acids have a huge role with retinal health as well.
So as you got into that, we were springboarding off of macular degeneration. How much of those nutrients are applicable to general eye health, and what ones are specific to that condition?
Again, right now, if you don't have a diagnosis of macular degeneration, most practitioners in eye care probably wouldn't recommend taking the specific supplementation that's called AREDS vitamins. There is not very strong evidence that it would help prevent developing macular degeneration. So it's still kind of debated amongst professionals if they recommend it or not. In general, though, things that are good for the eyes, we know that vitamin A is essential for retinal function. Most people in developed countries are not vitamin A deficient, but your body can get that either from beta carotene from eating plant vegetable sources. You can also get it from eating some meat-based sources. Certainly liver is probably the most famous one. You gotta be a little cautious though, because it is possible to get too much vitamin A and have hypervitaminosis, which too much vitamin A can also cause problems with the eye. But our body's really good at regulating vitamin A. The vitamin C is also really important for the eye. It's, in fact, one of the most highly concentrated places in your entire body of vitamin C is within your eye. It's about 15 times more concentrated in the eye than it is just in your blood serum plasma. And it's there because the lens inside the eye is avascular. There's no blood vessels getting to the lens. And so your aqueous humor, one of the liquids inside of the eye, needs vitamin C as a strong antioxidant to prevent cataract formation. With that being said, they've also done studies on vitamin C and have found that if somebody's malnourished, then supplementing with vitamin C may help slow down the development of cataracts. But if somebody isn't deficient in vitamin C, adding more to it doesn't have a clinically meaningful benefit to preventing cataracts. But still, vitamin C, beta carotene, or vitamin A, very good for the eyes. Zinc in general is believed to be very good for the eye. There are a few studies that maybe raise a risk factor for some people that zinc could cause macular degeneration specifically to get worse. Largely not accepted as a whole in the industry because the company that made those publications also happened to have invested interest in the genetic test to determine if you're susceptible to zinc or not. So I think more research is needed to have a final conclusion on that. But they did reduce the initial ARED studies had 80 milligrams of zinc. And then they said, hey, that's a lot of zinc, especially because a lot of people are taking other forms of multivitamins and things. So they dropped it down. And so somewhere between 15 to up to about like 20 some milligrams of zinc is in a lot of the ARED formulas now. Some are zinc free. You can find those too. Most research though does support that getting your supplements or vitamins and everything, your nutrients from just eating whole foods and eating a diet that's more along a true Mediterranean diet is by far the best at reducing risk for eye diseases and for keeping the eye healthy.
You mentioned there the risk when somebody's taking beta carotene if they're previously a smoker for cancer. Do you know if that is also connected to vitamin A specifically or just beta carotene?
To my knowledge, it's just beta carotene. I can't say I understand the exact mechanism of why that is, but that was based on some larger scaled studies. I believe that was done in Europe. I could be mistaken, but it was kind of fascinating. But ever since then, they still obviously getting beta carotene from natural sources is not a concern, but taking kind of beta carotene isolate if you'd previously smoked may increase the risk.
Before we leave macular degeneration, you mentioned their age being a risk factor, but I didn't catch any other risk factors. It sounds like there's some mystery there of who's getting this. For people now that are aware of this disease and how scary it is, anything we can do to mitigate risk?
Yeah, thanks for asking that and kind of clarifying this. So other than, genetics, we can't really control, right? But lifestyle-wise, smoking, number one. And thankfully, smoking is the rates amount of people who are smoking has decreased. But smoking is a very strong risk factor. Other components, sunlight exposure. Again, there are studies that link sunlight exposure as being higher. So I still recommend UV light protection, There's still some debate if blue light glasses outside are recommended or not, but at least UV light protection. They find, again, diet, eating a Mediterranean diet, and I like to say ancestral or whole food Mediterranean diet, right? You don't want all this extra kind of mystery chemistry that is in a lot of processed foods. Watching cholesterol or really saturated fat has been higher levels of saturated fat have been linked, have a stronger association with the rate of macular degeneration. Trying to think what else. There's been other studies and research that have connected it, but most things aren't a very strong association. But eating really healthy has been shown to reduce the risk. A study that came out this last year from the American Clinical Journal of Nutrition, they even found that people who ate at least 2.7 servings of green leafy vegetables a week, it's not that much, right? A week, had about a 25% reduced risk of progression in that condition. People who ate oily fish, again, omega-3s play a role in retinal health because the photoreceptors in the retina have about 50 to 60% of them are DHA, omega-3. People who ate 2 servings of fish a week have about a 21% reduced risk. But synergistically, if people are eating both green leafy vegetables and oily fish a week, they have about a 41% reduced risk in progression of that disease. So I do encourage people to try to focus on what they are eating, because we know food affects so many health things in the body, and they definitely affect our eyes. So that's another thing I try to encourage people to try to eat healthy. And if they have a hard time, getting green leafy vegetables in their body for either medical conditions, digestive issues, or they choose not to eat green leafy vegetables for some reason, then there are benefits of even taking supplementation of lutein and zeaxanthin on their own. Those are carotenoids that specifically are found in high abundance in green leafy vegetables, but they deposit specifically in the eye and kind of work as either a shield against high energy blue light, but they also have anti-inflammatory and antioxidant capacity within the retina. And that's at least something that you can choose to supplement with.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Diabetes affects the eyes significantly. Not only does diabetes increase the risk for things like cataracts, diabetes affects the blood vessels throughout your body. And the retina in the back of the eye is one of the most highly vascular organs in your body.